Hi, everybody. I'm going to get us started just in, to be respectful of everyone's time. Thank you for joining us today for our little tutorial on hazard vulnerability analysis and your facility-based risk assessment, which, as you all know, is a part of your emergency preparedness program. And really what we're going to demonstrate today is really where you get started. It's the backbone of it all. So just a few housekeeping items for today. Today's session is being recorded, as the lovely hostess explained to us all. So while we do encourage you to participate, we want you to do that in the chat feature, and we do have someone monitoring chat for your questions, and we will leave time at the end of the presentation for you to ask questions. We do want you to keep yourself on mute though, just so that we can minimize the disruptions to the presentation. So here we are on the iPro QIN-QIO family, so to speak, as I'd like to refer to us. iPro QIN-QIO is a federally funded Medicare Quality Innovation Network quality improvement organization. And for those of you who aren't familiar with us, we're kind of broken up into different, there's three QIOs that work on this project, and that's iPro in New York, New Jersey, and Ohio, and HealthCentric in Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. That's the longest one to say. That's in one breath. Clarent is Maryland, Delaware, and the District of Columbia. So together, we are three different organizations, but we're all working towards the same goal, and that's to improve healthcare for CMS recipients. And now, if anyone asks you if you know what a QIN-QIO is or who your QIN-QIO is, check your state, check the list of organizations there, and you can answer in the affirmative that yes, you do know who that is. So a few learning objectives for today. We're going to talk about the key participants to be included in your facility emergency preparedness committee. We're going to talk about some best practices for engaging community partners in the development of your emergency preparedness program, which we all know is very, very important, not just for getting through your survey, but for protecting the people that we take care of every day. And we're going to describe how community partners can assist in conducting your hazard vulnerability analysis and your facility-based risk assessment. You never have to start from scratch on that one, and we're going to share some strategies for that. And then we're going to talk about how the four components of your emergency preparedness program, how you, not so much your plan, but your program, everything is related to this one key valuable tool, which is your hazard vulnerability assessment. And we're going to do a demo so that you can see how that works, take a little bit out of the mystery out of that, and I'll answer any questions when we're done on how to do that. So I know that most of you have way too many responsibilities, way too many hats, not enough staff to get your work done. And the very last thing that you want to do right now is ask your staff to be on another committee or plan another meeting or create another line on the to-do list or pile on your desk. But if ever there was one that's important, it's your emergency preparedness program. So hopefully this won't be too painful. I know it sounds like a lot of work and not much fun right now, but when you're done, you're going to get to meet some new people. You're going to get to make a mess. It is going to get messy at times because there's going to be some discussions that will be had about different hazards and resources that are available and strategies to address things that are going to happen at your facilities. But the end result is you're going to get to know the people around the table, And it's really important to do that before something happens rather than when something is happening. It's never a good idea to meet the local responders or your EMA folks in the middle of the night amid red and blue flashing lights. It's always much better to do it around a table with some juice and coffee and donuts, and have a nice organized discussion about the what ifs of running a healthcare facility. So within your facility, you should be creating an emergency preparedness committee. And I know that staffing is tight, and that while there are a lot of people, a lot of positions listed on this slide, and many of them may be being done by one person may be filling 3 of these roles, one person may be filling 2 of them. These are the folks that you want to have around the table from your organization when you're putting this initial hazard vulnerability analysis meeting together. These are also the folks that you're going to want to work with when you get back together after you do your HVA. With your HVA is the, I'm going to use the acronym from now on. HVA is the acronym for Hazard Vulnerability Analysis. So after you have that HVA meeting with your community partners, these are the folks that you're going to want to get back together at the facility level to do your facility-based risk assessment. And we're going to talk about that one too. So when we talk about community partners, everybody thinks about fire and EMS because that's who you guys probably interact with the most. You have a problem, you have a patient that needs a higher level of care, needs transported to the hospital. So that's probably who you're most used to working with. Maybe the private ambulance services, the transport services that get your residents and patients to other kinds of treatments that you do not provide at your facility. Law enforcement isn't one that is typically engaged, although given the climate that is out there right now in healthcare with the increase in violence in the workplace, particularly in healthcare workplaces, I would encourage you to invite them to the table. If for no other reason, they can take a look at your facility, and from that law enforcement security perspective, look at the vulnerabilities of your facility and maybe give you some tips on, hey, maybe this door shouldn't always be available to anyone. You should have key card access. Maybe you need to have just one door that anyone can come in, and it's got, an initial door and then a second door. And some of those are going to be structural changes that you're not going to be able to make happen, but they're pretty creative on slowing down a threat. So I would definitely encourage you to invite them to that. Local health departments are also very good at the hazard vulnerability analysis process. It's something that they have to do. They participate on the community level with emergency management agencies. And if any of you who are on the presentation don't know who your EMA is, don't know how to find them, don't know how to get in contact with them, aren't connected with your healthcare or your local health department, we're going to share our contact information at the end of this. I am always available to help you track those folks down, make a connection. There is no shame in that kind of stalking. We call it relationship building. And I'm happy to help you do that. When you are putting together this community partners meeting, don't be afraid to invite other long-term care facilities that are around you. I know that there's, a little bit of competitive nature to your industry. It doesn't have to be that way, especially when we're talking about protecting people and caring for them. So those can be community partners too. Another excellent strategy is to get all the long-term care facilities together and then invite public health and invite emergency management. So it's one meeting, because your HVA really does have a lot to do with the geographic location or the community that you're located in. So it's kind of going to be the same. And a lot of that work has already been done for you, and you're just going to go through it and look at it from a facility perspective. If you can engage your hospital partners that you work with on a regular basis, they all have emergency managers. They also are versed in the HVA process, and they can help guide you through these meetings and take a little bit of the mystery out of it. And then there's this other entity out there called a state or regional healthcare coalition. And that coalition has a coordinator. And this is a group that's EMS, public health, hospitals, emergency management. And a lot of them include nursing homes. Some of them don't, but I'm happy to help you try and make that connection, because when you are in need of resources, this is the group that they all know each other. They all know their plans. They plan, they train, they exercise together. It's a good connection to make. So again, if that's something you're interested in learning more about, certainly reach out to me and I'll help you figure out who those people are in your area. So we just talked about a lot of this, who to reach out to and how to do it. I'm telling you, you never underestimate the power of coffee and donuts, but every community is different. Like we said, some of you may not know about healthcare coalitions, what to ask for when you make that connection. Most EMAs, I'd say almost all EMAs know that you guys have to have emergency preparedness plans. And they are very, very happy to know that you are working on that effort and that they're getting to hear what your plan is, and they're meeting you before something happens, because this is another one of those things where they don't want to meet you when an incident happens. And this way they know what your facility is like. They know the resources that you have. They know the resources that you might need. And they can actually help you in writing your plan, on finding vendors, on where you can find some of those things. And when you're planning for the meeting, you need a sign-in sheet, because you have to document that this happened. And I highly recommend a scribe to take notes on the sticking points when you're talking about going through the HVA and the things that you maybe weren't quite sure of, and there was a question mark on the planning for that. So you can revisit those so you don't get hung up, so you don't tie up your whole meeting on something that really could be put in the parking lot and revisited with a smaller group, because I know how valuable your time is. And what will be accomplished by going through this process is really the backbone of your emergency preparedness program. So we talked about this a little bit in the first session last week. I don't know if all of you were with us for that, but you've got your HVA and then your facility-based risk assessment. You have the policies and procedures, which are really going to be dictated by the results of your HVA and your facility-based risk assessment. Your communication plan is going to be different based on the scenarios that you're experiencing, that you've identified in your HVA. And then the other great thing is, and I'll show you this when we do the HVA spreadsheet. It's gonna kick out your top 5 or 10. I can't remember off the top of my head how many it puts on the chart, but it's going to show you your biggest vulnerabilities. And that's really what you want to build your training and exercise program around. So I know that you have things that you have to plan for, like the elopement of a resident. I know you have to be able to communicate with families. You have to be able to recall your staff. You have to have plans for feeding your staff and your residents. But all of these things are really built off this one tool, this HVA, and it's kind of like a roadmap to creating a plan. So this is where it starts to get fun. We're going to talk about hazard versus risk. And a hazard is, of course, the potential harm. It's something external. It's often geographic, like your facility is located next to a railroad track. I think we've all seen the news. Trains seem to be derailing everywhere. People in our organization seem to send me emails now whenever a train derails. So I'm kind of synonymous with disaster at iPro, and I don't mind that. It's something that I enjoy. But these are the things in your community that can cause harm. So maybe you have a chemical processing plant. Maybe you have, like in Perry, we've got the nuclear power plants here in Ohio, but they are related to your geographic location. Buffalo, you've got your crazy snowstorms that I hear about every winter. Down south, it's hurricanes. In the Northeast, it's flooding. And everybody's going to have, high heat, climate change, all the things that are associated with that. The hazards are things that you cannot change. Now, the risks can be changed, and the risk is the hazard and your exposure to it. So you can actually change your risk by minimizing your exposure to it. And that is done 3 ways: through prevention, planning, and partnership. And I'm going to give you an example of that. And this is it's non-traditional, not something you typically see in an emergency management presentation, but our hazard is the shark in this scenario, and your risk is loss of life and limb. And the exposure is interaction with sharks. So your problem is you really, really like sharks. So you want to see them, you want to be around them, you want to interact with them. I don't recommend taking selfies with them, but that's what this young man thought was a good idea. And this, by no means a true story picture, something open source found on the internet. But how do we decrease the chance of loss of life and limb? So prevention, we don't want to interact with the sharks at all. You're going to stay home on the couch with your popcorn, and you're going to watch Shark Week, and you're going to appreciate those sharks from the safety of your living room. So planning a way to minimize the risk, but the risk is still there. You're going to go to an aquarium, and you're going to look at the sharks in the aquarium. Is there the chance that maybe that glass is going to break and the sharks are going to get out? Sure. It's a very low risk though. So you get to appreciate the sharks up close and personal. And sometimes you can even take a behind the scenes tour, but it's very, very supervised, and the risk is very minimal to you. Now, a slightly different task, you're a little more exposed, is the partnership. And you can go on a supervised shark dive with a reputable shark diving expert. So that's just an illustration of some of the things you can do to lessen your risk, lessen your exposure to a hazard. And that can be done with all the hazards that you face. So let's look at some of the hazards now. You have your communications failure. You have fires, floods, gas leaks, generator failure, HVAC failure, inclement weather, infectious disease, patient elopement, power outage, staffing shortage, supply chain shortage, temperature extremes, utility failures, water disruption, workplace violence. So all of these things at the very top, you have already started to lessen your risk by talking about them, by planning, and by having your HVA meeting. So we're going to go on to the Kaiser Permanente HVA tool. And this tool has been around for a really long time. It's been, there's been several revisions and reiterations to this tool as time has gone by. Tammy's going to put the link in the chat for all of you so that you have it and you can bookmark it. And what I am going to do is bring up the tool itself and show you how to use it. So here is our HVA tool. So this is a spreadsheet already built for you. The formulas and the calculations are already in here. It has some instructions in here on how to do this and some definitions on the rating systems that you're going to use. One of the benefits of inviting your public health, your hospital partners, your EMA, is they use this tool all the time. You guys have to do this annually. They have to do this annually. There's a whole other tool that's much more complicated than this called a THIRA, which is a threat hazard identification risk analysis that applies to an entire geographic area. They've got that tool. So they can do these in an hour. So they can help guide you through this process. And that's one of the benefits of partnering with someone, because by partnering with an expert, you can also lessen your risk. So the first thing you're going to want to do on this tool is on the input, you're going to put the year, obviously, because you have to do this annually. You want to save it when you complete it. And then you want to put your facility's name and your address. And these fields are already built into it for you. This is just a fillable spreadsheet. The next thing is the HVA tool itself. And as you can see, let me see if I can make this a little bit smaller so you guys get a better picture. And hopefully you can still see that. So it has, now I have to move over this way. Okay, here are all your hazards. And they're all listed out, and they're obviously in alphabetical order. So let's go through one. Let's do air quality issue. The likelihood that this could happen given current events, let's say that's high. Now, how many times have you received alerts on this? How many times have you gotten an air quality alert from whatever weather app you follow and thought, okay, what do I need to do at my facility? And let's say I know that I at least am getting those, well, it seems like pretty much daily. It's not going to let me do this one. Number of times that you have activated your emergency plan. It will let you, I think it's this right now is in a protected view. When you do this, it's going to let you enter these things. But these are the discussions you're going to have around the table with your community partners. And they're going to advise you on, don't get too hung up on the numbers, because they're going to advise you on how to score these things. But then when we move over here, what's the impact of an air quality alert to your facility? And let's say that it's a 2. And like I said, don't get hung up on the numbers. As long as you're using like a consistent thought process when you're selecting your numbers, you're going to be okay. So what's the property impact, which is, the losses and damages to your facility? For an air quality alert, maybe not that much. So it could be low for that one. And this is a drop-down menu, so you can just select them that way. But interruption of service, your residents may not be able to go outside. You may have to turn off your air handler. You may need fans. If it's super hot, you may need to evacuate. These are all the things you're going to talk about with your staff, your preparedness committee, and then your community partners. And this is, can you pre-plan for this? Well, yeah, we can pre-plan. We can do a pretty extensive plan for an air quality alert. The initial response, how timely will it be? How effective? What resources? Let's say that's moderate. And then the external response, are you going to need assistance from someone outside of your facility? We're getting so good at those, maybe not. So then it automatically calculates what your risk percentage is. And I'm not going to do a whole bunch of these, but I do want to show you the things that are on here, because the things that you're required to plan for, according to Appendix C, which everyone loves to read, I know. Whenever you're having a sleepless night, I'm sure that's a page turner for you. They're all listed here. Some of them won't apply to you. A child abduction may not apply to your facility, but then you just go through and you list those as zeros. But you see you've got generator failure. That's something you have to think about. Hurricanes, if you're up here in the Northeast, and unless we're in, talking about Superstorm Sandy, you don't really have to worry that much about hurricanes. So don't spend a lot of time on the things that aren't going to impact you, like a landslide. Probably not. Pandemic, you're probably going to want to talk about this one now. Whereas before, pre-COVID, I don't think a lot of people would have spent a great deal of time on this. So I hope you never have to deal with picketing, because I know you're already having a staffing problem as it is. Sewage failure, though, sheltering in place because of the train derailment in East Palestine, for instance, they sheltered in place. Supply chain shortages are something we're all experiencing. No one is really going to have to plan for a tsunami. So you can see the things that are on here are really going to guide your discussion. And then when you get through to this summary tab, and because we didn't do a whole lot, it didn't calculate a lot, but I'm going to show you. I'm going to stop sharing this screen, and we're going to go back to sharing this screen. And when you are done, you are going to get, oh, that I skipped that one there. This is what that landing page is going to look like from that link that was shared in the chat. So you can see on here, it does say it's the California Hospital Association. They're pretty much every hospital association has got this tool out there. Some health departments have it out there. I would stay away from the health department ones because they have some stuff on it that aren't, it's just a lot of information that isn't going to apply to you. This really is the simplest one. And that's what I tried to find for you, the simplest one. So start here. And that's what the landing page for that link looks like. And when you're finished with that whole process of ranking everything, you're going to get this little chart with the bar graphs. And it's going to show you your top 10 HVA. So if you're looking down here, you're seeing flood, fire, patient surge, power outage, earthquakes. This is a California tool. HVAC failure, evacuation, explosion, IT system outage, and water contamination. So then when you are looking at your policies that you have to write, these are the policies that you start with. The ones, and it'll show you all of them ranked. These are just the top 10. But that last page will let you access the whole list in order. And if it shows up on your HVA, then you should have a policy for it. So, and now I know in Appendix Z, hazard vulnerability assessment and facility-based assessment and the word assessment in general is just kind of used interchangeably. I want to just say that when you're thinking of the hazard vulnerability assessment, you're thinking of the external things that can impact your facility. When you're talking about the facility-based assessment, those are the things inside that you can lessen the impact of through planning, prevention, and partnership. So those 3 Ps. So they go with the facility-based assessment. So this also is something that you have to complete annually at a very minimum, but changes in the level of care you provide, perhaps the staffing that you have available to you, the type of patients that you have. This facility-based assessment may change given a certain situation, or maybe an emergency situation that you have to activate your plan for, and you're gonna go through this process in an abbreviated fashion to make sure that you're thinking of all the things that are going to help you protect your resident patient population. So these are some of the things that are going to impact you updating your facility-based assessment. So you admit different residents whose care needs are previously not something that you provided. And it just serves as a record for staff and management to understand the reasoning for the decisions made regarding the staffing and the use of your resources. So the example given there of the residents on ventilators or dialysis, and then you do the assessment and update that to include how the facility staff and resources, the physical environment, et cetera, were changed or altered, strategies changed to meet the needs of those residents requiring that specialized attention. And those things would be like the training or different supplies that you ordered to provide that care. Now here's another one, and this link is going to go in the chat. And this one is a more of a worksheet than that spreadsheet is, and not so much the self-guided tool that the spreadsheet was. So this one, you're all seeing now, the facility assessment tool. This one is a little different, and it comes with some instructions, and this one is 18 pages long. It's not as short as the HVA, and you all thought that was the long tool. This is the one that's the long tool, but it's the one that has a lot of guidance on it. This one was updated in 2022, so this is the most recent one that we've got for you, and it has all these guidelines in it for conducting it. And then what it does is it's got these, and you can do this with pen and pencil. You can do it on a computer, whichever is easier for you. Just make sure that you do it, you document it, you date it. Again, create a sign-in sheet to say who was there when you did it. Because the really great thing about, I say this tongue in cheek, the really great thing about a surveyor asking for your emergency preparedness plan is for them to see these documents, to see your HVA, to see the sign-in sheet of who was there. That documents the community partners that were there for you. If someone has taken notes, it documents the discussion. You have your sign-in sheet. It shows the community partner engagement. Same thing with this document. You want to have that sign-in sheet so that you can show that this was a multidisciplinary team within your facility that had this discussion, and that all aspects of care inside your facility were represented. So this one really kind of goes through all the different things. This one's more of a checklist, more of like, did you consider this? Did you consider that? And then it's got some things you can fill out. And Sherilyn or Tammy, if you want to jump in here, because I am not a clinical person, folks. I'm an emergency manager, homeland security person who just happens to understand how it works in healthcare. But later when we get to the Q&A part, if you have questions about this form, I think Tammy and Sherilyn are probably going to be our subject matter experts on this. But you see, these are like a snapshot in time of what's going on in your facility. And when it changes, that's when you need to pull this out and take a look at it again. And always save the documentation. You can never over document something. It's always good, because staff changes, administrators change, there's high turnover. The more documentation that you have, because people may not be there anymore, the better off you're going to be. So you all have that tool. Now we're going to go back to our HVA presentation, or our PowerPoint presentation. So that being said, that was the landing page for the tool. See, these got put in this morning. So they're out of my script that I've practiced for you all. But this is the landing page to get to that checklist that the link was put in the chat for. So like we talked about at the beginning, what does all this analysis and assessment get you? When you're finished, you're going to have the outline for your emergency preparedness plan. You're going to have a list of all the elements that need to be addressed by your policies and procedures. And you're going to have a framework for your training and exercise program that you're going to go through with your staff. So when we talk about policies, I like to think of it this way. The policy is, you have to have it because it popped up on the HVA. And the policy is the broad strokes, the broad picture. This is the hazard. These are the things that can result from this hazard. And then when you start to go into the procedures or your SOPs or whatever you call them within your facility, those procedures are going to be the nitty-gritty that you're going to train your staff on. And those are going to become the things that you're going to want to include in exercises. So this is how is all that information going to help you? So these are some of the things that are on the HVA. And I just want to talk about like one that affects everybody is a power outage. And that can happen in any season, right? It could be because there was so much snow that the power lines fell down, or an ice storm pulled down the trees and they pulled down the power lines. Or it could be, from heavy rains. There's any number of ways that you can experience a power outage. Well, that power outage is not just going to happen in a vacuum. It's going to impact all these other things. So the power outage is the trigger for your communications failure because your phones are hooked up to electricity, or you have voice over internet phones and now you don't have an internet connection. That power outage has maybe kicked on your generator, but the generator failed. You don't have HVAC because you don't have power. So a lot of these things are interrelated. And I guess the point that I'm trying to make here is when you're writing your plan, don't think that you have to have a specific policy for each thing down to the detail, because a lot of the elements of planning for all of these hazards on here are going to look the same. It's your procedures that are going to be more detailed, because all of these things are going to start off kind of the same with the same discussion. Can we keep the residents here? Do we have the staff to take care of them? Do we need to evacuate? It's just these are just the triggers that are going to make someone go and get the binder and look at the policy and then the procedures. And the procedures are really where you need to focus on with your staff. So that being said, this is your nursing home team from all of the 3 QIN-QIOs. And if you have questions and you go to these folks with the questions and they can't answer it, and I assure you they probably can, because they've been doing this for a while. And a lot of these people have some real world emergency preparedness experience. They've either worked in facilities similar to yours, or they've been working in healthcare quality improvement for a very long time. They are always available to you to help. And then you also have access to myself and Tammy and Sherlyn, and we are more than happy to help you. And all you have to do is send me an email and say, Tracy, I need further explanation on X. And I will we can set up a meeting. You can show me what you've got. We can talk strategy. I can look at a portion of your plan. I can maybe make some suggestions or ask you some questions that might clarify things. The other thing that I can help you with is creative ways to have exercises, because I know that they're a pain in the butt to plan, and they seem like a very daunting task, but they don't have to be. And there's some really fun ways to do them. And I'm happy to share those with you, and I'm happy to talk to you about those things. That's what I'm here for. Everybody that knows me likes to joke that I'm a professional worrier. That is no lie. I live in the land of worst case scenario, and there really isn't anything that we can't help you figure out. So please use us as tools in your toolbox when it comes to developing your plans and procedures. So with that, that's the end of our presentation. But if we have any questions, I'd certainly love to hear questions if anyone has any. Tammy, do we have any questions?
Just have a question from Kurt asking how to access the assessment, which I did put the link in the chat, but I can also email that as well.
Okay. The link for the assessment is going to take you to that landing page. That let me back this back up here. So that facility assessment tool, the link is going to take you to this page. And if you can see down here at the bottom where it says click here to download the optional facility assessment tool, this isn't by any means exhaustive or all inclusive. It's a good starting place. And you may think of things to add to it based on your facility or the type of care or staff or capabilities that you have. But this little link right here is where you're going to find that checklist, that 18-page checklist. And you can certainly customize that too. It's a Word document. You can change it, alter it to meet your needs. So
and can I just say, Tracy, that I know there's questions of how they receive this, the link. We will send out anyone who registered, we will email and give that information as well.
Yes. And you are all going to get, and we aren't even going to make sure that, like, we aren't even going to hold you hostage and say, if you don't do this survey, you can't have this recording. We're not going to do that to you. This was recorded. So that you'll be able to go back and listen to it. And maybe there is something that I said where you need clarification. You'll be able to go back and revisit this. And then in this survey, if there is something that you want more information regarding, just go ahead and type that in there. Or if it's something that you want, like, to see a future technical assistance program on, feel free to type that in there, because we're here to help you, and we're happy to create these type of programs or resources or checklists, or just, you know, little things to help you along the way to lessen the burden of creating an emergency preparedness program, because I know it is a lot. It is a lot. So, any other questions?
Tracy, I did put the links back in the chat again. There were a couple of people who didn't see them either. They joined late or had bad connections, so I put them back in there.
Okay. All right. Well, there is the QR code. All you guys have to do is hold your phone up to that, and that's going to take you to the survey. Please do complete that. It's 2 questions, if I remember correctly, maybe 3, but I think it's 2. And just go right ahead and there is one of them is something that you can just type free form in there. So, let me know if there's something else that you want or something else you'd like to hear more information on. If we don't have anything else, last call for questions. I'm going to give you guys back 12 minutes of your day and hope that you don't have to use it to inhale your lunch. Anything else?
I don't see any other questions.
Okay. When I'm sharing my screen like this, I can't see the chat. So without a great deal of window opening, which always seems to go terribly wrong. So I thank you all for joining us. And I thank you for your commitment to planning for emergencies and not waiting until they happen. My favorite saying is when you have an airplane on fire on the runway, that's not the time to start the discussion about whether or not you need to buy a fire truck. And I think if we all go by that policy, we'll all be in a lot better place. So with that, I'm gonna bring this session to a close. If anyone else has anything to add, Sherilyn, Tammy?
Oh, go ahead, Tammy.
I was just gonna say, please join us next week for the 3rd session at noon on Thursday. It'll be covering communication and training and testing.
Do we have the registration link for that we could put in the chat?
Don't have it available quickly, but I can try to pull that up very quickly.
We can also email that out again. And the nursing home team can email that out again too. So.
Yes, it has been going out in the weekly
Okay.
email.
All right. Well, that's all I have for today. Thank you for
Ryan.
joining us.
Ryan just put it in there too.
Oh, thank you.
Ryan saves the day again. Thank you, Ryan. All right, everyone. Have a great Thursday. Enjoy your weekend.
Thank you. Thanks,
Thank you very much
Tracy.
for doing. All right.
Thank
Thank
you.
you, guys.